If you think you have varicose veins and you went to see a vein specialist, would the specialist automatically know how to treat you, or would you have to go through a series of tests?
It was thought for many years that doctors knew exactly what was going on inside the legs, and there's lots of tests that medical students and junior doctors are still tested on to see whether they can guess which veins they're coming from. But in the 1980s that was shown to be guesswork. Basically, if a doctor who treats veins all the time looks at a leg and examines it with varicose veins and then says which veins need treatment, they're only right about 1/3 of the time. It's essential to have tests. Now originally we used to use x-rays and that's not needed anymore. Then we went on to things like this, the handheld Doppler, where we can actually listen to the veins themselves. But the problem with this is, this doesn't tell you which vein you're listening to or how deep it is, and you can have 2 or 3 veins in a row, and so you're not really sure which one you're listening to. So this is now really obsolete and shouldn't be used except for in very rare circumstances. Nowadays we use a specialist scan called a duplex ultrasound scan, which when performed in a specialist unit by people who've been trained to a high enough standard, you can see every single vein in the leg. You can see which ones are working, which ones aren't working, how they connect, what the size is, what the shape of the vein is, and that's how we can always get the right treatments. Not only knowing which vein, but also which of the techniques would be optimal to be used to close that vein successfully.
There's also a test called a PPG. What exactly is that?
Photoplethysmography is a technique where we can measure non-invasively, so with no needles at all, we can measure the pressure in the legs. What that does, we put a little diode onto the leg, which is like a little red light onto the leg lower down, ask the patient to move their foot 10 times, and then we can actually watch the trace to see how the blood settles down again. It's an incredibly useful test because it tells us the function of the veins. So with the duplex, we can tell the shape of the veins, how big they are, which ones are working, which ones aren't, but it doesn't actually tell us how severe the veins are refluxing and therefore how quickly you're going to get ulcers. The PPG doesn't tell us anything about which veins are the problems, but it does tell us how severely they're refluxing, in other words, how severe the disease is and how likely it is to get ulcers in the near future.
Are there any other specialised tests that somebody might have at the Whiteley Clinic?
Yes, what we've found is that in 1 in 5 ladies who've had a vaginal delivery in the past, their varicose veins actually come from the pelvis. This might be associated with signs or symptoms of a thing called pelvic congestion syndrome, which is an aching in the legs, irritable bladder, irritable bowel, pain on sexual intercourse, or it might have been seen by vulval or vaginal varicose veins, or indeed it might not have even been noticed at all and we just find it when we scan the legs. In those patients, the varicose veins aren't coming from the legs themselves, they're actually coming from inside the pelvis, and so therefore we would have to treat those first to get a very good result. And not treating that is a major reason why so many ladies get their veins back elsewhere by having other sorts of surgery. In those patients, when we find veins in that position, we actually offer them a transvaginal duplex scan. It's the same duplex ultrasound scan and very similar to you'd have for anything else like having a baby, and it's done transvaginally so we can actually see the veins around the ovaries and how they come out into the legs.